All right, good morning, everyone. Can you all hear me at the back? Great. All right, good morning, everyone. Welcome to our panel on healthcare strategy amidst policy changes. As we all know, there have been a lot of changes in the recent world. We live in a very volatile world today. Particularly on trade policy, there have been a lot of changes, global supply chain shifts, and we have leaders from pharmaceutical sector, from devices, from providers here to discuss the changes and the impact of these changes. So good morning, everyone. Welcome. Let me quickly introduce myself. I'm Vinayak Deshpande. I'm a professor of operations here at Kenan-Flagler. I do research in healthcare delivery, and I also teach a class on healthcare delivery. One of my areas of research is also global supply chains. So I'm really interested in what my panelists have to say about supply chains amidst all the policy changes that we are experiencing today. So I'm going to quickly ask our panelists to do a quick brief introduction of themselves, and then we can get started. So we can start with you.
Yeah, hi, good morning, everyone. I'm Dave Moore. I'm the president of Novo Nordisk. Novo Nordisk is a global pharmaceutical company. It's about 100 years old. We're focused mainly in diabetes, obesity, and rare disease. And two of our most well-known medicines are Ozempic and Wegovy.
Good morning, everybody. My name is Jeff Strickler. I'm with UNC Health. I'm in a two-part role where I am the president of UNC Chatham, which is a 25-bed critical access hospital in Siler City, as well as I'm the overall administrator, which is the chief operating officer position for UNC Hillsborough, which is a 160-plus bed campus in Hillsborough, North Carolina. So looking forward to this panel.
Hi, everyone. My name is Susan Zimmerman. I'm Director of International Government Affairs for Siemens Healthineers. Siemens Healthineers is one of the largest manufacturers of medical equipment and technological solutions for healthcare in the world. We manufacture equipment to identify, diagnose, and treat some of the world's most common non-communicable diseases. And I'm proud to be here today to speak on trade policy. Thanks.
So thank you all. Let's get started. So as we all know, policy changes and supply chain shifts impact every aspect of healthcare. It impacts input costs, it impacts availability of pharmaceuticals, it impacts costs in manufacturing, it impacts the devices sector, it impacts the provider sector. So given that background, what I want to ask the panelists first, and this is for all of you, is from where you sit today, what single trade policy, tariff announcement, or supply chain shifts that you've seen over the last year has had the biggest impact on your organization's strategy?
Sure, happy to go first. I think from where I sit, I would say that the imposition of the IEEPA tariffs have been the most disruptive this year. The IEEPA tariffs, that stands for the International Emergency Economic Powers Act. It is basically the mechanism by which the Trump administration has imposed far-reaching, wide range of tariffs on nearly every import from around the world into the United States. It has established a baseline of 10% tariffs from almost every country, and then a higher set of tariffs on a subset of countries based on what the administration sees as an imbalance of trade or sort of market distortive practices by these countries, and imposing these tariffs as a sort of punitive measure or a way to rebalance that trade. The reason why I say this is probably the most disruptive is because there's no revamping your supply chain to optimize your impact from these tariffs. Companies that have already changed their supply chains as a result of the COVID pandemic or as a result of previous policies, say in the first Trump administration, they are no longer able to get around these tariffs by friendshoring or nearshoring their global supply chains. Every country in the world has some sort of tariff imposed on it for imports into the United States. This is not unexpected, certainly harmful. It raises the prices for these imports, which then has a ripple effect across the healthcare policy space. And you know, in Washington, certainly prefer to advocate on a scalpel approach to tariff policy. This broad-ranging tariff application is certainly disruptive, and we'd prefer to see them applied more precisely to the most harmful and detrimental products or commercial adversaries. But disruptive can also be something positive too. So the IEEPA tariffs have also resulted in the bilateral negotiations between the United States and key trading partners, which in many ways have opened up some market access opportunities and sort of regulatory harmonization potential. So could go both ways, but I'd say the IEEPA tariffs are definitely the key thing this year that I've been keeping my eye on from my seat in Washington. Thanks.
Thank you. Dave, you want to take it?
Yeah, we had a lot going on over the last few months with respect to tariffs and pricing. So I personally received a letter from the president on an executive order for most favored nation pricing. All the large pharmaceutical companies received one. I framed it, sitting in my office, and it's not law, right? It's voluntary. But there were some real reasons to think about negotiating with the administration. And the negotiation is with the Center for Medicaid and Medicare Services, CMS. And the reason to do it is to get access to more people living with obesity and diabetes in the U.S., but also you get a free pass with tariffs. So the tariff arrangement that is in place right now, our company is headquartered in Denmark, and we serve about half the world's insulin, half. And that means we serve about half the U.S. insulin. So we had to find out, like, are you serious? Are you literally going to tariff a life-saving medicine like insulin? That's unprecedented. There's never been a tariff ever on a life-saving medicine that comes into the country from Europe. And we really needed to pressure test that and see if it were true. We still don't know the answer. But the tariffs are real, and the reason to negotiate and get to a pricing arrangement, what it did for us is opened up Medicare. So our business in obesity for anti-obesity medicines, Medicare does not cover them. It's not recognized yet by CMS. And in this negotiation, if we were to reach a fair price, we open up 40 more million Americans to obesity medicine. So last week, we were in the White House, myself and Eli Lilly, and we announced these new pricing arrangements with the administration. Got a little weird because someone fainted and I caught him, and then I ended up being on TV for the next few days. I was on Saturday Night Live twice on Saturday. And my daughter's studying abroad in Denmark. She said, "Dad, you're a meme." I said, "What's a meme?" And she sent it to me. But all in all, it was about access. And similar to what Susan said is, negotiating price can lead to some short-term pain, but really leads to the long-term view, which is more people have access to your medicines. We didn't do it because, we get a free pass with tariffs, but that was really the impetus, because most pharmaceutical companies import their medicines. Either the raw ingredients or the final drug product comes in from another country, and the exposure to tariffs is pretty serious.
Yeah, from the provider perspective.
Yeah, from a UNC health perspective, I'll do a little bit of a pivot on the question. So as it relates to supply chain tariff, it's really just one more thing in a wave of financial constraints that's hitting the healthcare system. For us, the more significant challenges was the impacts of the One Big Beautiful Bill, as well as the North Carolina rebasing situation that's been going on right now. For the One Big Beautiful Bill, it's projected at this point to be over a $1 billion impact to just UNC Health. And so when you couple that with the supply chain challenges, the increased cost of capital, the increased cost of construction, just the overall uncertainty as it relates to healthcare organizations such as CMS, the FDA that was discussed in the first panel, it's just having a across-the-board impact and really prevents us from being able to plan for the future. But of all of those impacts, probably right now, the one big beautiful bill is the one that has us the most concerned.
Thank you. So let's shift our attention to tariffs and supply chains. Those are very closely connected, interconnected. And let's talk about what implications it has in terms of supply chain strategy. So from your perspective, particularly for you, Dave, as you think about tariffs, has there been a shift in terms of supply chain thinking, given that you're a global company serving a global marketplace? How do you think in terms of supply chain strategy?
It absolutely does. On the pharmaceutical space, you kind of have sort of different segments of your supply chain that come together. So you have the active pharmaceutical ingredients, the raw materials, which can come from many different places. That requires a plant, right? There's a factory where you make your raw materials. We happen to make most of them in Denmark. Luckily, a few years ago, we built a plant in Clayton for API. There are not many of those plants in the U.S., but we were fortunate enough, not that we thought tariffs were coming, but that we set that up years ago for our pill. So very soon we're going to launch a product called Wegovy Pill. And we will be able to say that it is made end-to-end in Clayton. Raw materials to the final drug product. It's actually super rare in our industry. You see raw materials coming in from China and from India because they're less expensive and they're readily available, and that's where a lot of the generic companies are. And then what you'll see is you do your finished goods here sometimes, or a lot of companies have their finished goods in Ireland. Like some of the biggest exported drugs from Ireland are pharmaceuticals. And so what you're seeing is our company, as well as other companies, are having to shift that thinking. And you've seen a lot of announcements where we're reshoring, right, and bringing manufacturing back here. But it takes 5 years to build a plant and get the FDA to test it and validate it. It doesn't really help in this short term. So what you're seeing is companies trying to source their raw materials and set up an arrangement where it actually wouldn't be 100% tariffed, right? And there's an opportunity to sort of break it down from the drug substance to the drug product. And we're doing some of that as well. It's kind of just shifting the sort of the timing. And then ultimately what we're trying to do as well is to see if we can set that up fast enough where we can become a net exporter of some of our medicines. And that really flips it around, right? So instead of thinking about having to pay a tariff on everything, you actually can, balance that with the exportation of some of your medicines too. And our teams are working on that right now. Even if we're just sending it to Mexico or Canada, it's an export for us.
Thank you. So can you shed a little bit more light on your decision to start the Clayton manufacturing plant? Was that from the perspective of supply chain diversification perspective, making your supply chain more resilient? What was the thought process in
Yeah, I mean, I'd love to tell you it was because, we were thinking about, reshoring American manufacturing. The reality is it was just concentration risk. We had so much manufacturing, both API and finished goods in Denmark. You can't take that much risk of having it all in one country. And it's different in Asia. For example, in China, we manufacture China for China, right? And we do that in many countries. But North America was really served, from Denmark. So we built our first plant about 20 years ago, and it was a real success. The skilled workforce, the expertise that we were able to find in the Triangle area told us to just build another one. So in 2018, we had the single largest investment for pharmaceutical manufacturing in Carolina. It was $2.2 billion. And then last year, we just announced again the single largest investment ever, $4.2 billion. We're building a plant right now. Just the spine of the building is 5 football fields long. These are just these massive filling lines because our medicines are with self-injector pens, and it takes major scale up and lines to do that. And then we built another one in Durham, which is a tableting plant. So we have 4 manufacturing plants right here in the local area, and it serves the entire country right now for all of our medicines.
That's wonderful to know. I would like to hear from the rest of the panelists your opinion on the impact of supply chain strategy from your perspective as well.
Yeah, I think for us on the operations side of things, really a lesson that we've learned from the pandemic was to diversify our supply chain. Like many organizations, we were really looking for single source pricing. We were having just-in-time delivery. 2 examples really comes to mind to the impact of that and lessons learned. So during the pandemic, one of the great rate limiters that impacted our operations was latex gloves. There was a period of time we couldn't get them. When you look at our operations, it's absolutely essential. And so for a period of time, we actually had to stop elective surgeries because of the lack of being able to source latex gloves. The result of that was, we're going to sort of reach out to whoever, doesn't matter if it's US or global, doesn't really matter what we're paying for it, because we have to have those types of supplies. Another recent example is the impact of Hurricane Helene on an IV fluid plant, which was in Western North Carolina, which supplied almost 80% of IV fluids in the United States. And so that dramatically, impacted our operations. And again, we would seek out alternate, sources for that, but it just couldn't meet our demand. And so our clinicians really had to change the way that they would practice. And so I think the lessons learned with that is we need diversification. We need to keep some level of stockpile of supplies, and we just can't really put all of our eggs in a single basket.
Yeah, I think I'm going to tackle this question in the context of the Section 232 investigation that's currently underway on medical equipment. And I know I've put out a few trade wonky terms, IEPA, Section 232. So if any of y'all are interested in trade policy like me, this will really speak to you. But Section 232, I raise it because it's a mechanism by which the administration looks at the national security implications of a particular product and its supply chain, both within the United States and globally, to ensure that everything is in place to essentially future-proof that supply chain on these particularly critical products. So there's one underway on medical equipment, and Siemens Healthineers certainly weighed in on this investigation to help explain why our supply chain looks the way it does, why we rely on certain inputs from around the world, why we rely on friendshoring in our engagements with particular markets that are allies of the United States, and why the imposition of tariffs or other non-tariff measures as a result of this investigation would be detrimental to our provision of this life-saving equipment to patients, especially in the United States, as well as for the potential export of US-based innovation to other markets that may require it. And there's, most multinational companies have a global supply chain. This is natural. This is a result of years-long trends of globalization and markets really leaning into the production capacities that they are able to offer to these global supply chains to maximize foreign investment, right? And so there's a couple key things that we think about when we look at changing our supply chain or the constraints that we might have in changing our supply chain. The first one is a typical MRI machine made by a major manufacturer has upwards of 250 parts and components. Each one is authorized and certified by the FDA to conform to rigorous safety and performance standards. If you change one component of that, that results in the need to reauthorize or recertify or amend the authorization of that part, which takes a long time, to your point, Dave. And so the imposition of tariffs does not cause the immediate shift in supply chains. It's going to take a very long time, just from that one perspective alone. But then there's also the issue of there's certain elements in this equipment that you just can't find in the United States. For example, critical minerals are a necessary component to high-quality molecular imaging equipment, and those materials you can only find in China. Many of those materials you can only find in China. So that necessitates an agreement between the United States and China to enable access to these particular components, that we can continue to manufacture and integrate those components into our manufacturing base in the United States. And then there's other pieces like, this is very high value, high precision equipment, but low volume. And so the shift of supply chain to suppliers, say here in the United States, is not always the easiest because of the sort of scalability of that supply. And so we rely on our long-standing supply chains and suppliers around the world that we have honed over many, many years. And so again, that just doesn't change overnight. So there's a lot of constraints to onshoring or changing our supply chains, certainly things that we look at over time, but it's not an immediate prospect. And so that's some of the things we're grappling with this ever-evolving tariff and trade policy landscape.
Thank you. So you bring up a very important point, which is supply chain resilience. I've been talking to a lot of executives, both in healthcare as well as outside of healthcare, and the word resilience comes up a lot in my conversations. So I would like to know from you how you think about supply chain resilience and how important it is, in your own words, to construct supply chains that are resilient. So this is an open question to all of you. Yeah.
Absolutely critical. I mean, we just went through the worst nightmare of a pharmaceutical company the last couple of years, where we literally could not meet the demand for our products. Super rare in our industry. That does not happen, where we could not make enough of our medicine to serve the demand for our obesity medicines. And not only that, the obesity medicine, same ingredient as a diabetes medicine, and so then it put constraints on our diabetes medicines. It was just a stark reminder of how important it is to plan for outsized demands. And in building a network of internal and external, in our business, that's contract manufacturers. And then we had a contract manufacturer that had a problem with an FDA inspection, right? So all of these things happen, and you normally can handle it with your safety stocks, and it's very unusual to run into an issue like that. But our company, as well as Lilly, both went on the FDA drug shortage list, both went on the European drug shortage list, because we were not able to meet demands. And it also born a whole nother industry, which is compounded medicines, which you'll see advertised, fake GLP-1s that are being imported from China, which aren't even being imported for human use. They come in these containers that say not for human use. This is all because of the fact that we were not able to have a supply resiliency. And we just had to double down and contract with every manufacturer, build plants, change over our lines, and make it an absolute priority within the company. And we got through it, and we were taken off the drug shortage list in the beginning of the year, and Lilly was as well. But it just changes sort of the mindset and calculus now when we're thinking about launching new medicines and the potential for there to be demand that we just certainly could not plan for.
Thank you.
I'll add, Dave, I'm so glad that you mentioned the drug shortage list. And again, this is one of the things that you as consumers of healthcare, I'm sure you're not aware of. But I mean, the list is just sort of constant and ever evolving. And many of the shortages are medications that we use routinely in healthcare and are life-saving. And one example, that comes to my mind is epinephrine. It's not a high-margin drug. It's not something that you see really probably in the public space. But if you're or an individual suffers a cardiac arrest, it's essential. And our clinicians, again, are having to use alternatives, with that. And this is something that our pharmacy teams deal with daily. And it's ever evolving, and the list is getting longer rather than shorter.
Thank you. So, as a supply chain researcher, one of the questions that I've been looking into is how do companies make their supply chains more resilient? And I've heard lots of different kinds of answers, ranging from reshoring, friendshoring, nearshoring, China plus one. I've heard it all. Right? So there are lots of different ways to think about supply chain resilience because there are many trade-offs that are involved. And you mentioned many of those. There are lots of capital investments required. It takes time to make these changes in supply chains. I've also heard many companies taking a wait-and-see approach, for example. Because if you're going to make all of these changes which have long-term implications, you want to make sure that these have payoffs in the long run. So how are you thinking about balancing the risks of making these investments and changing supply chain strategy, particularly in your industry, Dave?
Yeah, I can go first. I think, you know, the investments are pretty substantial, right? When you're talking about capital investments of building new plants, right, in the billions of dollars, you need to be thoughtful and planful about that. And you know, as a public company, you have to think about what your shareholders are going to, you know, feel about these long-term capital expenditures. At the end of the day, I would say that our approach is, if we want to be sure, if we want to be certain, then it actually has to be in-house. And, you know, yes, it's important to have partnerships. It's an important aspect of kind of spreading the risk and ensuring resiliency. But if you want to be absolutely sure, it has to have a Novo Nordisk, you know, name on the building, because then we control the quality. Then we control, you know, our ability to set up a manufacturing that's kind of, you know, within what we think should be at our standards. And that's the approach that we've taken. I think one thing that we've been really careful about is building plants that can be multi-use. And so not to build a plant, for example, that could only be used for insulin, but we could change that, retrofit it, put a different line in if we had to. So it allows us to have some agility and some optionality.
Thank you. And from a provider perspective, Jeff, does the location really matter when you procure, or how important it is from your perspective?
Yeah. I mean, you know, location is of minimal consideration with us, and I've used a couple different examples with the latex gloves and IV fluids. Ultimately, we're going to acquire it wherever we can acquire it, and we're ultimately going to really pay whatever we have to pay for those, because these are essential services that we're providing. So ultimately, it just impacts the margin as it relates to the work that we're doing, which then in turn impacts the investments that we're making. So where we're at now, really in healthcare, with this level of uncertainty, is it's really impacting our decisions as it relates to growth, which then, as consumers, is really impacting you as it relates to access. And so you were talking about the MRI example. So the population data, the market data would all point that we're going to place a outpatient MRI center in X location. But that has not just the capital cost for the MRI, but the construction costs, all of which we're paying a premium on right now. And so it just makes us conservative and holding back on those things, even though in some of these cases the technology is offering better outcomes, faster diagnosis, quicker recovery for patients. And so that's just sort of the setting that we find ourselves in.
So the U.S. government has been discussing incentives as carrots and sticks for reshoring. So in your opinion, how realistic is reshoring as strategy? You have cited several examples of where you're doing that, but given the cost, expense, and the lead times that are involved, is that even desirable? Your thoughts? From a policy perspective, what are you seeing there?
Yeah, I think I've already spoken to some of the constraints around reshoring, but it also plays into look, we're a German headquartered company, Siemens Healthineers, but the U.S. is our largest employee base. Several of our business line headquarters are here in the United States, which I think is an indication of localizing our production and our manufacturing to where the need is greatest, which is a trend across the world. So we also, several speakers so far today have talked about China for China, which is certainly a situation that we cater to, or manufacturing close to the global south to reach patients in sort of low and middle income markets. Of course, we have a large manufacturing base in Europe to serve that market. So as we are looking at onshoring or friendshoring, it's really about bringing the equipment as close as possible to the communities that need it most. I mean, healthcare is a sector where you really have to be on the ground. It's hyper local. You have to be where the patients live and in their communities. I used to work in agriculture as well, which is literally tied to the land that people are on. So it's a very similar vein. But I think the policy conversations about onshoring or nearshoring are really trying to make the case that there's a lot we can be doing, and Siemens Healthineers is investing a lot in building up its capacities and capabilities within the United States. But there's some things that are just truly global, and like I mentioned, the materials that we can only source out of China for molecular imaging, you can't change that, and it will take a long time to even think about how we could change that. Or identifying new mining sources outside of China. Like it's not a prospect for tomorrow. So we're both making the case that we are considering this on a daily basis, how to onshore and friendshore and reshore, but and nearshore rather. But there's some things that are just going to take time.
It's a big decision, and I would say, first of all, industry. So far, it's mixed. For our industry, you've seen some companies come forward with big announcements. You've seen others kind of stay behind the scenes and wait and see. I think for many companies that are European based or else ours is similar, it was a pretty drastic announcement to hear there could be these tariffs, 25%, 50%. If you didn't start moving manufacturing here. So you saw some pretty big announcements. And then, you kind of saw some more details come out where the administration said, as long as shovels are in the ground, you're good. We know it takes a long time to build a plant. But it takes a long time to build a plant. And what if that changes in 3 years, 4 years, right? And now it's a new policy. And you already have, working supply chain set up in another country, and it's working just fine, and it's high quality and all of that. So it's a big decision. I do feel, to a certain degree, we were just lucky that we had already started building some, and that was already aligned, within our business needs, and the timing was pretty good, where we were able to say the cranes are still in the sky, like we are doing it, as we speak. But it's a big decision. It costs a lot more to manufacture here than it does in other countries. It just does. It costs a lot more to distribute our products here than it does in other countries. That's why when all this MFN stuff came out, the prices aren't exactly the same, because distribution is more expensive here than it is even in Europe. So I think it's a real individual decision. You have to think long and hard about it, because once you start building a plant, it's a big commitment. But you can't just pop up a plant. And so I'll give you a real story from last week. We met with the governor's office here in North Carolina because there's not enough water. We have so many plants in one area. There's enough water coming in, but there's an issue with the wastewater and the reuse. We actually have to build a reuse plant. So you have to partner with the government, because if you build a reuse plant, then many manufacturers could use it, right? And it could actually help North Carolina as a whole. But it's another couple $100 million, right? So these decisions, it's not so easy to just say, you can turn the switch and all of a sudden we make medicines here, instead of where they've been coming from, for decades.
If I can just add, Dave, not to mention the materials and the advanced robotics needed to erect these facilities are also facing tariffs.
That's right. Every bit of it, right? Yeah.
Yeah, so that's a nice segue to the next segment of our discussion. So shifting from supply chain, let's talk about the financial and patient impacts and where does that pressure land. So changes in trade policy obviously creates cost pressures from a variety of different ways, right? So it increases pressures on costs in manufacturing, changes availability of drugs and devices. So Jeff, this question is for you. Where does that pressure eventually land from a patient perspective?
Yeah, I mentioned this just a moment ago, that ultimately all of these things we're discussing up here impacts the access that you have to the care that you need or are seeking. And unfortunately, often this access is really borne by the marginalized patient populations. When I think about the rural environment, when I think about behavioral health, when I think about the concept that we have in this country of maternity care deserts, where there are many places in this country that you have to go for an hour or more to receive maternity care, that's where it ultimately shows up at. Sort of on the previous question, I was thinking about some of these points and how at a policy level, a lot of these conversations as it relates to tariffs and stuff is really short-sighted. And I mentioned how healthcare is in a period where we're conservative. We're not thinking about investing in new technology. We're not building other new sites where you could have access with the focus on all of the shoring strategies and the jobs that those would represent. Well, what about the jobs if we were building a hospital in a new hospital in eastern Chatham County, for example? What about the jobs that would come from running those sites? Everything from someone to work. It's not just the physicians and the nurses, but we need technicians. Healthcare needs somebody that's going to clean the facility. We have jobs for supplying. We have jobs in security. We have jobs in the facility side, from everything from HVAC to electricians to plumbers. So those are all things that healthcare as an industry is really sort of pulled the throttle back on. So I think these are just some of the, we're sort of the end of this chain. And so the impact that you're seeing as a consumer from access and what you're seeing with prospects from employment is where it ultimately shows its face.
Thank you. We'd also like to hear, is this impacting patient access to pharmaceuticals, drugs, the cost pressures? How does it impact the patients at the end? And from the devices too, I would love to hear from you, Susie.
Yeah, I mean, ultimately, yes. And we see it, right, in consumer goods as well. And ultimately, if there's an added tariff, it's going to show up somewhere, right? It's going to show up in your copay. It's going to show up in the premiums that the health insurers have to charge, right, to cover all these medicines if there's a big change in the cost of them. I think where we landed, at least for our company with the administration, is that we actually found a balance where there actually is a way to do this where you can lower prices, and either the actual price that we charge or the price that someone will pay out of pocket, and the increased volumes, offset some of that, right? So I think it's not the case in a lot of places. It's not the case in a lot of consumer goods where there is going to be this offset, right, where volumes can help ease the pain. And ultimately, it's going to make some things a little bit more affordable, and tough choices are made, and that's a hard thing if you're starting to take a choice between a medicine and other things that are within your budget.
Thank you.
I mean, I think it would echo a lot of what Dave was saying from the pharma side. It certainly applies to the medical technology side. You feel the cost pressures of tariff policy all throughout the supply chain, from suppliers all the way up to the end user, and certainly through the finished product side where we sit. We have a lot of mitigation measures in place to grapple with the real effects of tariffs, trying to read the tea leaves on where things are going to go on trade policy. And each passing month, and certainly in years to come, that impact is going to be a little bit less acute. But I think we are in the same boat as most players in this space. If you increase tariffs, you're going to increase the cost of healthcare for the end patient. So we're all teaming up as an industry together. Certainly in Washington, we're speaking as a single voice as to the harm that this sort of trade policy does have on the health of American citizens around the country, and just kind of hoping for a little bit of relief going forward.
Thank you. So maybe let's shift our discussions to some of the solutions through innovation. The previous panel also touched on innovation, and oftentimes constraints and disruptions are a motivation for innovation. So would love to hear from all of you as to what are some of the innovations that you're seeing at your side, driven because of many of these trade policy changes or tariffs or cost pressures. Are there innovations that are forthcoming that you see that may help us solve the issues that we are facing today? Questions open to all. Yeah.
I'm happy to start. Innovation is certainly our guiding light within Siemens Healthineers. We value our position in sort of being at the forefront of medical technology, especially as it pertains to reaching rural patients or rural healthcare institutions. Things like building algorithms to support the use of these machines, or artificial intelligence, sort of the cutting edge of medical technology. Now, I am not sure to what extent the tariff policy that we've just seen in the last few months have impacted that drive for innovation, but what I will say is I sit in the fortunate position of a large enterprise where I get to spend every day focused on rolling with the punches of trade policy. I get to absorb all those impacts, the day-to-day, the Truth Social posts, the executive orders. I get to take that in, understand what it means for our company, share it internally, and then understand internally what we're focused on so I can share it back with the government in sort of an advocacy capacity. And like I said, we're a large company, so I get to spend my time on that while my colleagues continue to drive the innovation that's going to bring us the next iterations of world-class equipment. Not every company is that fortunate, and I think the last panel talked a little bit about small and medium-sized enterprises that are impacted by trade policy, where they have to dedicate all their resources to grappling with increased tariffs. That may reduce the attention and energy that they are focusing on innovation. So from our side, certainly continuing down that path of finding the next great technological solution for healthcare, but I can't say it's the case for everybody in this sector.
So for healthcare, sort of the points I wanted to make, I'm going to take this from going from bad to good. So, the pandemic was this major disruptive event for healthcare. And for many of you, maybe the pandemic was over once the mask came away. But for healthcare, we felt the impact from the pandemic for 5+ years. And we're still only now, I think, beginning to sort of come out of that period of time. And it put us in this overall reactive cycle where it was a wave. As something come, we would respond to it. Then here comes the next wave, and we're responding to that. And so some of these things that are happening at the policy level is really one more wave of reactive things that are coming through healthcare. And so healthcare as an industry, I think we're suffering from a bit of disruption fatigue right now because of all these things that's happened over the last several years. And when we look at a lot of the things that are in the policy, really, I mentioned the One Big Beautiful Bill, and it's designed so that the impacts get worse in the years to come. And so the worst for us is potentially in the future. However, with that being said, like any disruptive event, it can lead to innovations. And so I believe that healthcare is at this evolutionary inflection point. And I use the IV fluid example for that. So all of us had just sort of gotten to the point to where patients come in, you start an IV. The first line of treatment is you give them a fluid bolus. And so when the access of that was really slowed down and almost to a stop, then we had to really question our practices. And we found out that patients do okay without that. In some cases, they actually do better without that. And so I think you're starting to see early on really questioning of long-standing practices that hopefully are going to lead to a wave of innovation in the future.
I like the disruption fatigue. I'm going to add another fatigues to mine with that one. But I can't imagine what it was like to run a hospital during the pandemic, honestly. It has to be something that you learned a lot from, yeah. On our side, we're an innovative medicines company. So the innovation is on the R&D side, of course. We're constantly looking to discover and research that next step up in innovation. But it also exists on the manufacturing side. So chemistry, manufacturing, and controls is a way for us to improve our yields, right? To improve the way that we manufacture our medicines. And when we launch a drug in the years leading up, the scale maybe isn't at a level that we want it to be, but we actually know our engineers are going to improve on that. We count on it. And so the years after the launch, we're working on our yields, we're working on our cost of goods, the way that we can coordinate a supply chain that is both resilience, as we talked about, but becomes less over time. I'll give you a couple examples. So some of our medicines, most actually, they require refrigeration. So the entire supply chain is cold chain. It's super expensive, right? And you're using these refrigerators all around the country. And so we're now looking for our GLP-1s to become heat stable. Heat stable. So you just eliminate cold chain and all the costs associated with that distribution. We're trying to make them once monthly. So you could, right there, you could remove, right, 75% of the injections and all of the materials that go with those injections as well. So it's not just on, the molecule and the target from a drug perspective, but also, in manufacturing, it can make a big difference over time.
So taking that a step further, you cited several examples. So let's talk about the future. So given all these policy changes, where do you think industry is headed in the future? And what makes you optimistic about some of the changes that you talked about that will help us overcome many of these challenges? You want to take that first?
You can start.
Yeah.
Yeah, I mean, similar to Siemens, the U.S. is our largest market. So we're a European company, but half our sales come from the U.S. It's not uncommon to see that, right? And so there's going to be a change in the future in the way we launch medicines based on this new policy from the administration. And a part of that executive order was, if you're going to launch new medicines in the U.S., they have to match those most favored nation prices. So that's a dramatic change in the way we think about launching. So what does it mean? Are we going to dramatically reduce our prices in the U.S., or are we going to raise them in Europe? I can tell you the goal would be to raise prices in Europe, right? Have them pay more of the fair share around innovation, because it's really been the U.S. that has been, footing most of that. It'll be a balance. It's not like they can be, completely equal, but you have to start thinking about the way you bring medicines, into the countries, how you sequence them, where you go first, where you go last, and it will change some of the way that we think about the launch strategies. Yeah.
I think sort of two things. So despite the fact that it's a challenging time as an industry with healthcare, I'm hopeful for the future for two reasons. One, I think a lot of the policy construct right now is just not sustainable. It's sort of built around political realities. And so I think at some point we'll see adjustments in some of those things, because as it is currently built, it would have dramatic impacts, ultimately bore by the consumers of our services. I think the other thing is I think there is this increasing awareness of then some of the realities and how we can work together in public-private partnerships for the good of the people that we serve. And so 2 North Carolina examples relate to that. We worked a couple years ago very closely with the state legislation to fund child and adolescent psychiatric care. And was able to open a site in Butner, North Carolina, because it was increasingly awareness that psychiatric care, which had been underfunded, was not just because of life's choices that someone made. It was impacting children across all demographics. And there was a groundswell of support to be able to add those services. The other thing, which you see the conversations in the news, is around the North Carolina Children's Hospital doing a large freestanding hospital to serve the entire state of North Carolina, and that being a partnership, not just the state legislation, but really other private organizations as well, because it's such a massive undertaking that no single party could do it themselves. Those kind of things coming together to meet a need give me hope for the future.
I really liked your answer on how policy can be temporary. I kind of live for that every day. And so, yeah, I do have the hope that some of these more detrimental and impactful trade policies are not long for this world, but also making the case that in order to maintain innovation in the medtech space, we need to maintain a free-flowing global supply chain, particularly with allied countries, with whom the United States is friends. I understand if there needs to be some measures on commercial adversaries, but especially with those such as Europe, maintaining that free-flowing global supply chain between the two, the trade lane between the two, is what's going to enable that sort of innovation that we're going to have to continue to work towards, because there's always going to be patients. We're all going to be touched in some way by a need for medical technology or pharmaceuticals, or our loved ones are, and we're always going to have the need to have faster identification of issues, faster treatment, more timely interventions, and so that drives that innovation. And so maintaining that trade flow is super critical, and I'm optimistic that we are going to get there, and that recognition is going to be there that this is how it's supposed to work in the global supply chain.
Thank you. I also want to leave some time for the audience to ask questions, so I'll wrap up with one last question. And you probably answered partially my last question, which is, if there's one policy that you could change or influence, what would that be for each one of you?
I'm happy to start very shortly. I think all medtech and pharmaceuticals should have a humanitarian exemption from many of these trade policies that limit the flow of products across borders. I think there's a recognition that these are timely, time-sensitive, and important devices and solutions that patients need immediately, and so they should not be wrapped up in trade policy.
Mine is not really a single policy, but it's really for there to be a recognition of the impact on healthcare operations and for operations to have a seat at the table. As you can imagine, it's often device suppliers, pharma, the providers that are recognized to have a seat at the table, but then there are things that aren't considered when it becomes the impact on the delivery of healthcare in the ambulatory environment, in hospitals. And so ends up being unintended consequences. So how can we be really thoughtful and have a seat at the table when these things are considered and discussed and decided upon?
As an operations professor, I really love that. Thank you.
You really hard time accepting that there's tariffs on life-saving medicines and devices. I mean, there's got to be exemptions. I think it's going to hurt care. It's going to hurt outcomes. It will limit innovation eventually as well. because choices will have to be made in terms of, which products come into the U.S. and which don't, which is never something that we dealt with before. Other countries did. But we always received the first innovation. It was always U.S. first, and we benefited from that as well.
Thank you. So we have 5 minutes approximately for Q&A, so turn it over to the audience. If you have questions, please do.
Hi, my name is Daniela. I'm a first-year MBA. My question is actually for Dave. So I'm curious, from your perspective, how the rise of direct-to-consumer platforms, so Lilly Direct, and I know Novo has NovoCare, how does that play a role in some of these challenges that we've been talking about, and how do you see Novo allocating resources in the future to better serve patients?
Yeah, it's really a phenomenon we've not seen in our industry. Thanks for the question, Danielle. There's this rise in consumerism for obesity, especially. I think we'll see it in other therapy areas, but in obesity, the consumer is really sort of taking charge of their health and that experience and journey. And as you mentioned, we went direct to consumer earlier this year. Lilly did before that. And all of this discussion the last couple of weeks around, having a governmental direct to consumer, we were actually the ones that said, we're already doing it and it's working as part of the pharma board. And it's more than what we would have expected in terms of the interest to just buy pharmaceuticals from us directly from our website. You still need a prescription, but we've never had that before. Drug companies never had a direct relationship with a patient. It was always through another third party, through the insurer, the doctor, or the pharmacy. And likewise, you're seeing a real rise in telehealth care and people choosing telehealth for their obesity care. There's reasons for that. Stigma associated with going to the doctor, being able to find care online. Some people, that works for them really well. But it's getting to the point where it's close to 30 to 40% of the prescriptions are coming through this direct. And so that means we just need to lean into it. If that's where the patient is, we need to meet them there. And you end up becoming a little bit more of a consumer-oriented company. And having that conversation, that relationship, not directly with the doctor, but more with the patient as well. And that brings challenges, in terms of that relationship and the conversation they have when they meet their provider. But we can't ignore it. It's something that is certainly here to stay. And I think potentially with these new prices, we'll actually have an announcement on Monday. I think you're going to see even more of it.
One more question. There's one at the back.
I feel like there's been a shift, but I think it's a question of degree, and I think it's all about the balance. We realized that the pendulum pre-pandemic probably went a little too far, and so we're trying to pull some of that back when we talk about diversification of suppliers, keeping a little bit more inventory on the shelves than we did in sort of the pre-pandemic state. But the business principles are still there, right? And so it's all a question of degree. And when I think about that continuum, I think it also depends upon what's happening overall for your organization. So as financial resources become constrained, then perhaps we become a little bit more restrictive, but then when we have global events that may happen, then perhaps we move the continuum just a little bit less restrictive. But so I think there was a change in philosophy, but again, I think it's a question of degree.
So let's thank our panelists for their time and sharing their insights. Really appreciate it. Thank you.